This conference will now be recorded.
Good morning, everyone. Thanks for joining us for today's virtual press conference from the front lines, a series of biweekly media updates from the Pennsylvania Healthcare Association to share insights from the front lines of COVID-19 in Pennsylvania's nursing homes, assisted living communities, and personal care homes. With a series of changes to Pennsylvania's voting processes this year, including some stemming from the COVID-19 pandemic, it's more important than ever that long-term care facilities are equipped to facilitate mail-in, absentee, and in-person voting for their residents. Pennsylvania's long-term care facilities are home to more than 50,000 voters. Today, PHCA President and CEO Zach Shamberg will discuss how long-term care facilities are preparing to support their residents' participation in the voting process and how both state and federal government will play a pivotal role. This virtual press conference is being recorded and will be available to you on the PHCA YouTube channel this afternoon. As a reminder, please set your GoToMeeting view option to view who's talking. At the conclusion of today's press conference, there will be an opportunity to ask questions. Please use the chat feature within GoToMeeting to let us know you have a question, and we'll make sure all of them are asked during this press conference. If you are using the web-based browser and don't have access to the chat function, please send your questions to svarner@phca.org. Thanks again for joining us, and I'll turn it over to Zach Shamberg, President and CEO of the Pennsylvania Healthcare Association.
Thank you, Shana. Good afternoon, everyone, and thank you for joining us today to talk about voting in long-term care, a process that as recent as last year seemed to run like clockwork. But today we find ourselves examining and addressing the validity of mail-in voting this year's general election. The very act of voting itself seems to be, aside from the COVID-19 pandemic, the single largest issue in this year's presidential campaigns. Long-term care residents have been uniquely impacted by both of these issues, the COVID-19 pandemic and the new voting guidelines, perhaps more than any other demographic or population across the country. Now, in prior years, and even earlier this year during the primary election, providing residents with the opportunity and the ability to vote was an important responsibility of every long-term care provider, be it a nursing home, personal care home, or assisted living community. But given November's election, and really the stakes of this election, this process has become more important than ever, and providers have stepped up to answer the call and to ensure that every vote, especially those in long-term care, will be counted this November 3rd. Being admitted into a nursing home or moving into a personal care home or an assisted living community doesn't mean that a resident must forfeit their involvement in the political process. In fact, in prior years, PHCA facilitated legislative visits or town halls or even debates in our member facilities. It was an opportunity for legislators as well as their challengers to meet voters and talk about the issues that were most important to them. Additionally, in prior years, many of our long-term care facilities even served as polling places in which members of their community would step inside the facilities to cast their ballots. But as we all well know, it's not as simple as it once was. In early March of this year, visitation in long-term care facilities was first limited and then restricted in almost all situations. Now, this was done to maintain and preserve the health and safety of our residents and staff. But for election purposes, it shut down long-term care facilities to both candidates and incumbent legislators. The only real opportunity to learn about politics and the upcoming election was to watch local or cable news. The grip and grin politics of years past, at least in long-term care, had to be postponed. So today, it's incumbent for frontline staff, activities directors, and social workers to help their residents once again get involved in the political process. And that's also a directive from federal, state, and local governments, including CMS, or the Centers for Medicare and Medicaid Services, which stated just that in a recent October 5th memo. Early last week, CMS directed nursing homes across the entire country that every resident must have the continued right to vote, and that nursing homes should have a plan to ensure that their residents can exercise that right, whether they're in person or by mail. Earlier this week, Pennsylvania's Department of Health followed suit, directing nursing home providers to follow that CMS guidance. The Department of Human Services issued their guidance last week for personal care homes and for assisted living communities. And yesterday, the Department of State published a very helpful voting guide for all long-term care facilities throughout the Commonwealth. I'm here to tell you today that PHCA members are actively working to follow each of those directives and to ensure that every vote in long-term care is counted on or before November 3rd. If a resident in a long-term care facility or community requests to vote and cast their ballot in person, facilities are ensuring that transportation is available. Even in the midst of a pandemic, in-person voting for most residents is not out of the question. If that same resident requires a mail-in ballot or an absentee ballot, facility staff are working to secure those materials and ensure that ballots are mailed back on time to meet all voting deadlines. Again, this is primarily conducted by activities directors and the social workers in our facilities. Given the ease of registering to vote online, staff are also ensuring that that happens for residents, whether it's a simple change of address for a new resident, or if that resident is registering for the very first time. We have stressed to PHCA members, establish a good line of communication among residents and their family members, and keep those family members aware of how residents are exercising their right to vote. And I would stress to the family members and the friends who have loved ones in long-term care, make sure you reach out to the facility and speak with the administrator or executive director. Speak to the frontline staff. Make sure that your loved one can vote. And if they need your help, staff will ensure that that can happen. As the family member of a loved one who has dementia and who's currently residing in a personal care home, I've learned time and time again that communication is key. Last week, PHCA issued a general election resource to our members, detailing their responsibilities as well as best practices on facilitating voting during the COVID-19 pandemic. Additionally, the American Bar Association Commission on Law and Aging and the Penn Memory Center issued a fantastic guide on assisting cognitively impaired individuals with voting. These resources are all available for public consumption on the PHCA COVID-19 webpage. It's important to note that CMS has advised against the use of nursing homes as polling locations for the general public for the November 3rd election. And we would urge the same to apply to personal care homes and assisted living communities. And we're hopeful to work with the Department of State and various counties throughout the Commonwealth to ensure that that happens. It's also important to thank Governor Wolf, the Department of State, and the Departments of Health and Human Services for their work to make voter registration and mail-in voting simpler for those in long-term care. Again, the simple act of voting has unfortunately become a partisan issue in our country. And to take a side on mail-in voting, especially, is really to choose between Democrats and Republicans. But PHCA represents the most vulnerable population in Pennsylvania, as well as hardworking frontline staff who may not be able to leave their shift to get to the polls. They should be able to register to vote in the simplest way possible, and they should be able to cast their ballot by mail or in person. I'll close with this. Many have asked which presidential candidate the long-term care sector should be supporting in this year's election. First, from a state perspective, we issue a candidate survey every 2 years. and we appreciate the feedback that we receive from incumbents and their challengers on issues affecting seniors, workers, and long-term care providers in Pennsylvania. In turn, we distribute that survey to our membership, and hopefully it helps them decide who they should elect to send to Harrisburg. But on the national stage, there is no questionnaire. There is no formal interview process. We determine who will support our sector from rallies, from press conferences, from debates, and from press releases. Unfortunately, in 2020, I have yet to see long-term care become a real issue during this presidential campaign. It was not asked about during the first presidential debate, and it's very rarely mentioned in stump speeches. Medicare is slowly becoming insolvent. Medicaid across the entire country is in need of reform. And long-term care has been and will continue to be at the center of the COVID-19 pandemic. So who does this sector support? The candidate who will support this sector and make our residents and our healthcare heroes the priority moving forward. Thank you very much for joining us, and I'm happy to take questions at this time.
Thanks, Zach. Just a reminder, please use the chat function within the platform to let us know that you have a question. We do have a few that were submitted earlier today, so I will go ahead and share those. Zach, the first question comes from, let's see. Is PHCA concerned or worried about potential roadblocks that COVID-19 presents for the state's long-term care facility residents?
Sure. I think it really goes back to the Postal Service and the system at large. Providers are most worried about mail-in ballots, getting to them on time and being able to meet those voting deadlines. So especially as COVID-19 and the pandemic have impacted the entire Postal Service, providers are really hoping that they'll get mail-in ballots, they'll get their absentee ballots, and they can get them to the county elections or to the polling places on time to meet every deadline. Again, we want to make sure, and providers want to make sure, that every vote counts and is in by the deadline.
Okay, great. The next question is, I'm wondering how providers are navigating accommodating residents who wish to vote in person and whether they're interpreting state guidance or regulations to mean that a resident who votes outside of the facility in person at a polling place would need to quarantine for 14 days.
Yeah, it's a great question. There's no need to put a resident who leaves the facility, the nursing home, personal care home, or assisted living community to vote, as long as they follow the recommendations for masking and social distancing in quarantine following that voting process, unless there's been an actual exposure that's identified. If the resident is already in the yellow phase, that's because they've been exposed and it's equivalent to a quarantine, so they wouldn't leave the facility in the first place. In that case, they would hopefully vote by mail. So no, there's no need to quarantine unless an actual exposure has been identified.
Next question, does PHCA represent providers who care for those with Alzheimer's or dementia? And if so, how would someone determine if someone with Alzheimer's or dementia would be capable of voting?
Yeah, another great question. And again, this question really hits home for my family and I, especially this year. Given the election, it's something that we've done a lot of research on. The report I referred to earlier, the American Bar Association Commission on Law and Aging and the Penn Memory Center, the guide that those groups put together spells this out very succinctly. As a caregiver or as a helper, your job is to ask your resident if he or she wants to vote. And if he or she answers yes, you ask if there's any assistance needed. My opinion, or a caregiver's opinion, on a person's choice to vote is not relevant. If the resident indicates a choice among ballot selections on a mail-in ballot or an absentee ballot, their reasons for their choices are not relevant. All that matters is that the person for whom you provide support is allowed to vote and his or her preferences are respected. And we learned this earlier this year. A medical diagnosis does not disqualify a person from voting. And a diagnosis of Alzheimer's disease or dementia does not disqualify a person from being eligible to vote. I hope that answers the question.
Zach, another question. Any sense as to how many counties are moving public polling places out of personal care, assisted living, memory care, or skilled nursing facilities?
Not yet. Again, we have reached out to the Department of State. We're working with the Department of Health and Human Services. We do know anecdotally that some polling places have been moved already, but we don't know if every county has decided to move forward and move those polling places. We'll be following up, and hopefully we can answer that question shortly.
Another question here. This is not about voting in particular. Yesterday morning, DOH officials announced Pennsylvania was at the start of a fall resurgence or second wave of COVID-19. During the press conference, officials talked about working with internal and external stakeholders, including a number of healthcare associations, to develop fall preparedness plans and distribution plans for a potential vaccine. Was PHCA included in those discussions?
By my count, and from watching yesterday's press conference, we know that the Hospital Association of Pennsylvania, the Medical Society of Pennsylvania, pharmacists, individual hospitals, and educators were brought to the table. Unfortunately, the providers at the epicenter of this pandemic were not. We have been calling for a seat at the proverbial table since March. That call, for whatever reason, continues to be ignored. As we've stated, since March, long-term care must be the priority for vaccines and for testing and for any ounce of relief effort moving forward. And I would reiterate that call that providers need a seat at the table to ensure that these supplies get to where they need to go. We were extremely disappointed with yesterday's announcement. And again, to hear that those at the epicenter of this pandemic had been ignored and not brought to the conversation.
Another question, this one on the topic of voting. Some providers haven't yet received mail-in ballots. If they get closer to election day, can providers acquire affidavits from every voter to obtain permission to take their ballots to a drop box? Or is mailing them back in bulk the most viable option?
Yeah, at this point, and I think all options are being explored, I do believe that mailing them back in bulk would be the most viable option. If providers in certain counties have not received their ballots, we're going to encourage providers in our membership to reach out to the county boards of election. Again, we'll keep the lines of communication open with the Department of State, but if there are any delays on the front end, we'll make sure that the problem is fixed on the back end, so that these ballots get to where they need to go on time and so that they're counted.
Another question about how prevalent are documented complaints from nursing homes or residents of nursing homes who say that they weren't given the opportunity to vote or were unable to get help in voting?
Yeah, as far as we know, not very prevalent across the state. We'd really have to look at the numbers going back to the primary election earlier this year or the general election back in 2016 or any time in between to see if there were complaints filed. Again, we're doing everything that we can as far as communication with our providers, with our residents, with our staff, with the family members of those residents to ensure that this year with all the changes in voting, things go smoothly and everybody has the opportunity to vote.
Thanks, Zach. That looks like all the questions that have been shared in the chat feature. I'll go ahead and make one last call. If you have any questions, please be sure to add them into the chat feature of GoToMeeting so we can get those questions asked. As a reminder, the recording of today's press conference will be available on the PHCA YouTube channel later today. Again, that looks like that's all we have. So we'll go ahead and wrap up. If there's anyone who has a follow-up question, or if you had a question that wasn't answered, please reach out directly at svarner@phca.org, and we'll get back with you as soon as we can. Thanks so much for joining us today.
Thanks, everyone.